to actually take a look at the U.S. and how spending on different illnesses or on average sort of differs by sort of geography. And it's very revealing. Anyone remember the article from the New Yorker about McAllen, Texas, but Atul Gawande? Does anyone remember that from a couple years ago? I'll post it on the website so you guys can take a look at it. It talks about a town in which spending is very high, but outcomes are not very good. Right? So this is one of the big mysteries: is we have a lot of spending differences. We also have outcome differences, but they're not really correlated in the way we'd expect. We're not necessarily getting a much better outcomes. We necessarily spend a lot more. Okay. So why don't the uninsured purchase health insurance? Right? This is a question. We've talked about insurance models. We've talked about how all risk-averse individuals would opt to purchase full insurance if they could purchase full insurance.
Vietnam is a really lovely place to live and work in. But if you're going to live and work there, it's important you give some consideration to your health insurance. The reason is that basic healthcare treatment, a trip to the local clinic, is not going to be that expensive. But in the event of a serious medical issue or an accident, let's say a car accident, then most people are going to want to be evacuated. The most likely destination is going to be either Thailand or possibly Singapore or possibly Hong Kong. Health insurers can do this, but it's important you buy the right plan with the right coverage. Most health insurance plans from an international insurer today are built in a modular form. What that means is the inpatient component is the core section that you must buy. But beyond that, you have the option to add on things such as outpatient, which would cover GPs and diagnostic testing and medication, or dental or maternity. So if you're going to start in a family, it's important you buy that module. Or, and this is the important one, there's an evacuation component. This is not always automatically included. So if it's not, make sure you add it on if you're going to be living and working in Vietnam. There are lots of international insurers you can work with. AXA, Allianz, DKV, Bupa, Cigna, Aetna. The list is very long. And there's also quite a few names that you perhaps wouldn't have heard of, but may be a good option for you. Our job as an international insurance intermediary is to help you find the right option. If you come and work with us, we'll spend some time, first of all, understanding your needs, what you're looking for, and then basically assessing all the options available, coming back with some selected options for you, and then actually narrowing it down and finding the right insurance plan with the right coverage. Of course, if you're living and working in Vietnam, we'll make sure you have that evacuation component. So if you need help or advice about living and working in Vietnam and getting good health insurance, please come and talk to us.